Mask, the almighty mask, the only thing that can prevent me against the coronavirus. We all know these masks. Some people love them, some people hate them, and some people just can't stand them. And it's truly because they do not believe that the science backs them up as much as the media and the doctors portray them to. But is this true? Are masks not as effective as people claim them to be? This video is not advising you to wear a mask or not to wear a mask. Instead, this video will be analyzing what has been said about masks and their effectiveness during and before this pandemic. The purpose behind wearing masks is said that they block the wearer from spits, sprays, droplets that can come from the mouth or nose of other people. Coronavirus is primarily airborne and therefore is commonly contracted by infected droplets landing on a person. These droplets can be transported from talking, coughing, sneezing, shouting, etc. With the mask blocking these airways, it is said to keep the wearer from contracting the virus. Currently, the CDC is advising for the use of cloth face masks and non-surgical ones to preserve the surgical and N95 ones for those in emergency services. It is reported that cloth masks are 67% effective in protecting the wearer, but there are some limitations to it, which we will discuss in a moment. A study was done by the CDC in July that showed that although participants in the study wore face masks, they still contracted COVID-19. 70% of the participants who contracted COVID said that they always wore their masks. Always. Of course, there are some limitations to the study. For example, some participants did go out and were in close contact with someone who had COVID. However, it is interesting that even though they wore the masks always, the person still contracted it. This does not dismiss the use of masks entirely, but it puts it into perspective of our reliance on this cloth covering that is often used as our savior against the virus. Prior to the coronavirus outbreak, the CDC released a document which noted the differences between surgical masks and N95 masks. This document took note of their limitations as well. They said surgical masks protect against large droplets, but they are loose-fitting and do not provide proper filtration to prevent against small particles, as well as the leakage from the sides, which causes the effectiveness to be, well, not as effective. The document mentions the effectiveness of N95 masks. They mention that they prevent against 95% of airborne particles. But although the masks have a greater percentage of protection, most people are not wearing them properly, causing for their effectiveness to be not as, well, effective. To remind you, we are told not to use these masks, surgical and N95, to preserve them for doctors. But it leads us to wonder, if these masks have limitations, how is my mask from Walmart going to protect me against the disease? This also leads to another comment of the effectiveness of masks and the lack of use of masks on a mass scale for other illnesses in the past. An illness that is often brought into question and compared to the coronavirus is the flu. Many people dismiss the comparison of the flu and COVID. However, the flu and COVID are quite similar in some ways. For instance, how they're contracted and spread. The flu is often spread through the air when a sick person coughs or sneezes. However, masks are never recommended on a mass level for the flu as they are for the coronavirus. The CDC says in order to prevent the flu, the person can vaccinate, avoid contact with sick people, avoid touching your eyes, nose, and mouth, and to wash your hands. Masks are typically not recommended for the flu, or at least in the past they weren't. Some people say the flu is not comparable to COVID due to the lack of mass contraction and death of the flu. However, the numbers of the flu, the data of the flu is not often talked about, at least not as often as we've talked about corona. Before we dive into the numbers, there are some things to consider. The flu has a vaccine that is sent out during each flu season to prevent contraction. And the flu is also recorded in seasons that usually range from October to February, sometimes as late as May. Each flu season is measured as a season. So when the season begins, we start from zero. Whereas when we're talking about COVID, we just keep adding on to the original number of COVID contractions. Currently, there have been 11.4 million cases of COVID-19 in the US. Total deaths are at 249,670. In 2017 through 2018, the flu season was one of the worst that we have ever seen. In the 2017-2018 season, it is estimated that 47 million people got influenza, and that 21 million went to a healthcare provider, and that 810,000 people were hospitalized, and 61,000 people died from influenza. In 2009, 60 million people were sick with influenza. Interestingly, NPR posted an article in '09 that said, experts say the masks make sense for certain groups, people who are sick, and healthcare workers who are most likely to come in close contact with infected people. Although in '09 masks were recommended, they were only recommended to those who were sick and healthcare workers who will come in contact with sick people. The contraction and deaths in the 2009 to 2010 season and in the 2017 to 2018 season are relatively close to the contraction and deaths of those of corona. However, masks were never mandated. Another thing to take note is that the season of the flu months are less months that we are counting for the months of COVID. And the flu also had a vaccine. This portrayal that the flu is not comparable to COVID is utter nonsense. By looking at the numbers, it appears the flu is more of a threat to the people than COVID is. We do understand that masks may ease the minds of some people, but the mass mask mandate that is taking place in many states throughout our country is questionable. And the reason why it's questionable is because we wonder why the nation has decided to take action now and not during the deadly disease that is the flu.